So far, we studied about what is dentistry, what are the specialities of dentistry, what are the subspecialties of dentistry, and what are the skills and the qualities a dentist should possess to be to be a good or to be a successful practitioner. Now we are going to study about the anatomy of the uh, teeth, the anatomy of the teeth. Well, see, the moment we say dentist, the general public has the notion that we deal only with the teeth. That's not right. We deal with the teeth. We study about the teeth and the structures around the teeth. So, in under this anatomy, we are going to study about the different parts of the teeth and the different types of teeth and their various functions and the timing, the when they come and when the eruption sequence and uh, other basic knowledge about the teeth. See, the reason why we are supposed to know this anatomy and the chronological chronology of the teeth is because the most of the times. So I'll come to that, but we'll start with the anatomy. Starting with the anatomy, there are the different parts of the teeth is the number one, the outermost structure, that is enamel. It is the hardest and the outer part of the tooth. Okay, enamel is mostly made of calcium phosphate. It's a rock hard mineral. It is the hardest part of the body. Then comes is below that is the dentine. It's a layer that is below the enamel. It is again a hard tissue that contains small microscopic tubes. When the enamel is damaged, then the damage or the decay, when it damages the enamel and goes into the dentine, only then you'll start feeling the sensitivity and the pain. So all these things, all the sensitivity and pain is felt after the it starts reaching the dentine. That's because the enamel doesn't have the nerve supply. The nerve endings is not there for the enamel. It is there in the dentine. So only where there is the nerve endings, only there you'll feel the pain and sensitivity. Below that, the red part is called as the pulp, that is the heart of the teeth, tooth, whatever. It is the softer living inner structure of teeth. Um, the pulp is nothing but it's an entangled structure of the blood vessels and the nerves, and it is encased within the dentine. Then the outside part of the dentine in the root part. Okay, when it comes to the crown part, the the tooth can be divided into the crown and the root part. In the crown part, will have dentine and the enamel. When it comes to the root part, inside part is the dentine. The outer layer is called a cementum. It's a layer of connective tissue that binds the roots of the teeth firmly to the gums and the jawbone. Then around the teeth, the structure around the teeth is called as the periodontal ligament. That is called as PDL. That is a periodontal ligament. This tissue that helps to hold the teeth tightly against the jaw. So a normal adult will usually have a 32 teeth. Okay. That is, the normal adult usually will have 32 permanent teeth. Usually, when we ask our students about how many teeth does a human being possess during his lifetime, they usually say it as 32. That's not right, because the an individual in his lifetime, in on a normal basis, will have about 52 teeth. that is 20 milk teeth or deciduous teeth we call, and 32 permanent teeth. So when for the milk teeth, in the milk teeth we have two incisors, one canine and two molars, wherein the in one arch. So we usually divide it as maxillary arch and mandibular arch. Maxillary is upper arch and the mandibular is lower arch. So in the maxillary arch, there will be two incisors. In the when it comes to the permanent teeth, we'll have two incisors, one canine, two premolars and three molars. So on one side, we divide it as quadrant. So in the upper arch, on one side, one quadrant, we see we'll have about 2 plus 1 plus 2 plus 3. So 8 teeth in total. So on one side, on the upper arch, there are 4 incisors, 2 canines, 4 premolars, and 6 molars. So, where in case of the milk teeth or deciduous teeth, they will not be premolars. So, incisors 8 in number totally. So, 4 in the upper, 4 in the lower. They are the front teeth. Then comes the canine. They are we call it as a cornerstone of the mouth. They are about 4 in number, 2 in the upper, 2 on the lower, 2 on either side. Then premolars, they are 8 in number, 2 on either side in the upper and 2 on either side in the lower. Then comes his molar, they are the flat teeth in the rear side of the mouth. They are meant for grinding. They usually the incisors, we say the front teeth are for looks and the back teeth are for chewing. So, wisdom teeth, they are called as third molars. So, they are the part of three molars. On the last tooth, that is called as mm, third molar. So, these teeth erupt at around age of 18, but due to the lack of the space, they get stuck inside the jaw. So, we end up removing those teeth. As you see in this picture, there are different parts of the teeth. So there are different teeth. There are as you see, there are two incisors. This is a quadrant, one quadrant of one arch, and two incisors, one canine, two premolars, and three molars are there. When it comes to the individual structures within the tooth, you see the enamel, dentine, pulp, the root, the gum tissues, then the cementum, and the contents of the pulp, that is blood vessels and nerves are there. This white part around the tooth supporting structure is called as bone. Now, we are going to see about at what age the different teeth erupts is very important. The reason why this is important is to know what is abnormal, first we should know what is normal. So the most frequently asked question is the parents get their kids to our clinic. They walk into our practice and they say, "This tooth has fallen. The milk tooth has fallen, and the permanent tooth has not come yet. It is more than 6 months." So you should be able to know. You should know, is that normal or abnormal, to inform the patient. So if you see here, the central incisors, the lateral incisors, the canines and cuspids, then the first molars and second molars, they all erupt at different ages. So, in the upper, usually the first permanent teeth to erupt is the first molars in the lower jaw, then the incisors, then the lateral incisors, then when it comes to the lower jaw, usually the canines erupt. In case of the upper jaw, the first premolars erupt, then comes his second premolars, then comes his upper canine, then the lower premolar, then the second molar, then the third molar. So, but this is normal on a normal basis. Usually, this is the sequence of eruption of teeth, but there can be variation depending on the individual, depending on the sex. That means The girls, it might erupt a little faster in the girls than boys. So it depends on it. There are so many reasons for different teeth to erupt at different time.